Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. There is no escaping the news. COVID-19 is on the rise and no county or community in Maine is immune from it yet. Today we'll help you weigh the cost and benefit of celebrating the holidays with your employees. Have you heard of coronaphobia? It's a real thing. We'll explain what it can mean for your employees and customers so you can be prepared. We're also honored to welcome a special guest, Dana Connors, President of the Maine State Chamber. We'll learn more about the many ways they are trying to support Maine businesses during these unprecedented times. And we'll provide up-to-date information on COVID-19. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Suzanne Mooreshead, an Infection Control Specialist at Northern Light Health, Dr. John Campbell, a psychiatrist who serves as the Senior Physician Executive and Chief Medical Informatics Officer at Northern Light Acadia, Dana Connors, President of Maine State Chamber of Commerce, Dr. John Armstrong, Senior Family Medicine Resident Physician at Northern Light Eastern Maine Medical Center. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function, and I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following our hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Let's get started. First, our panelists will share useful information from their areas of expertise, and then we will have questions and answers. First up is Suzanne Mooreshead. I always appreciate the very practical approach you help us take to safely live and work during this pandemic. What should we consider when celebrating this unique holiday season? Suzanne?
Thank you, Dr. Gilkey. Good morning. As everybody's aware, this year the holidays are going to look vastly different than what they have looked like in the years past. And the question that I've been asked the most lately is just how can we celebrate and what can we celebrate during this holiday season, both at work and at home? While I'm going to concentrate mostly on the work setting, please keep in mind that any of these tips could be applied to any holiday celebration that you have in your own home. The very first thing that you need to do in terms of planning whether or not you can have a celebration is to look to see how many cases of COVID-19 there are in your local area. Maine CDC provides countywide numbers, and that should be your starting point. Just go to the Maine CDC site and click on your county, and you can find out just what the prevalence of COVID is in your local area. Now, this could be a little bit trickier if you have staff at multiple locations across the state, or if you have some staff that's working remotely and some that are working in-house. In those cases, you're really going to have to compare the risks from each location and decide on what makes the most sense for the majority of your employees. Also, make sure that you're following the Maine CDC regulations on size of gatherings, as that in itself may be the determining factor on just what you're able to do. Generally, most people most people keep within the same social groups, whether it's at home or in their community. Holidays tend to be a little bit differently. Historically, extended families get together. And this brings an added risk. If you know that your staff will be interacting with groups that they don't normally interact with now, from a risk perspective, this year may not be a good year to have that in-person get together at all. You also have to keep in mind what are the risk factors of your employees and who would be in those attendance. If you have a lot of staff over 65, or if they have chronic health conditions such as diabetes or cancer or almost any number of long chronic respiratory issues, whatever you choose to do, there should at least be a remote option to allow for those people to attend virtually. Another consideration that you need to take into account is whether or not it'll just be for employees or if family members also will be attending. If you are doing that in-person event, if family members come, they bring extra risks to that gathering. So are you confident that whoever that +1 or +2 that would be coming to the event doesn't have an exposure that could affect your business later on? Now, if you decide that for some portion of a celebration in-house, that you're going to be able to do that in-house, there are some things that you need to ask yourself, and there's some rules that you probably should make in advance. The first one is, will everybody be masked? Ideally, this is yes. There really shouldn't be much of an option about that. But this could be a little bit tricky if you have food involved, because that obviously has periods of time that people are unmasked. I'm going to get to more about food in a moment, but it's certainly a big consideration. Also, another question you should be asking is, will you be screening people for symptoms as they come into the gathering? Or are you going to ask staff to self-isolate for a week or two prior to whatever that event is? And as I mentioned earlier, always keep in the back of your mind what happens to your business if there is an exposure. Is this in-person event important enough for the morale of your staff that the risk is worth it? Also, some of the other things you need to keep in mind are, how are you going to keep people spaced throughout? Is there going to be mingling allowed? And I certainly would recommend that if there are groups of people that normally work together, you keep those groups together and you don't necessarily encourage interacting with groups that they don't work together on a normal basis. And again, how are you going to keep your most vulnerable employees safe? And the other thing is, don't be afraid to cancel the gathering at the very last moment. And I would be very upfront about it initially, that this could happen, that it's a tentative plan, but as things change and the risks in the community changes, that you may have to cancel. And also keep in mind, whatever you do during Thanksgiving may look vastly different from later winter holidays, because the risk of the community may change better or worse between those two events. Now, if you get to this point and you still decide that the benefit does, outweigh the risks, some of the, important considerations are, what are you going to do about food and gifts? And I do get asked those questions on a fairly regular basis. Food and eating is really one of those riskiest activities. If at all possible, avoid it completely. There's really no way that you can safely have a group of people, interacting and having food, because masks are going to be off. And that's really where we see some of the largest transmissions, are in these small gatherings where people are eating. And on that same token, if you normally have kind of a cocktail hour, this is not going to be the year for it. If you do want to have some type of food, if you're going to continue down that route, at the very least, make sure people are staying 6 feet apart and they're staying within whatever their normal social bubbles are. I would also completely avoid any type of buffet or family style meal, just because those are so challenging. Now, gifts, on the other hand, they have fewer risks. If you do have at some point some type of gift exchange, my one big suggestion is going to be is have everybody bring the gift to wherever that location is at least a week prior to the event and just let it sit there during that week-long period before they're exchanged. And also keep hand sanitizer nearby so it's readily available before and after anybody handles those packages. I know that what I've just said somewhat's going to make the holidays seem a little bit less fun and less celebratory, but really this year may be one of the most memorable holidays yet. Embrace the difference, and your employees are going to really remember this into the future. Use Zoom and virtual options to your advantage. You might want to consider running a recurring loop of photos of, various activities that happened during the course of this very unusual year. You could also try something different. Instead of that ugly sweater contest that people tend to do in the past, make this year the ugly mask contest. And, make it something, embrace the difference. Also, if you can plan an outside activity, certainly go for it. Maybe a bonfire, and hot chocolate where people can stand apart from each other but still enjoy the company and the warmth of that fire. And just remember, at the same time, start making plans for next year. Next year will be different. There's a lot of good things coming around the corner as we approach 2021, and it is right around the corner. So enjoy.
Well, thank you, Suzanne. You really got me thinking. Ugly mask contest. Next is Dr. John Campbell. Over the last month, we have learned of a new official diagnosis, coronaphobia. While it has nothing to do with fear of Mexican beer, what do we need to know? Dr. Campbell? You're on mute.
Hello, everyone. I'm John Campbell, and I'm the Senior Physician Executive at Acadia Hospital, Northern Light Acadia Hospital. Thank you for the opportunity to give this talk and to share information about coronavirus, and in particular, fears of coronavirus or coronaphobia. Why don't we go to the next slide, please? So back in the spring, as the coronavirus pandemic in the United States began to spike, we began to notice changes in people's behavior around their health care. People with serious medical conditions, heart disease and strokes, were not showing up to emergency rooms. We found this to be highly unusual because these are very consistent patterns of hospital usage and incidence of these conditions in the community. You can see from some of the information here to support that. Our feeling was that there might be a fear of coming to the emergency room, but we were also aware that as people are hunkering down, they're engaging in behaviors that are less healthy. They're more sedentary, they're not eating the healthy foods, and this led to some great concern in the medical community. Let's go to the next slide. Coincident with this, the worldwide medical literature began to show publications from around the globe that the general populations of nations during the pandemic are experiencing significant symptoms of anxiety. These are two studies, as an example, one from Turkey on the left, the one on the right is Argentina. And you can see from this data that there is a great deal of distress in the populations, and that distress and anxiety manifests itself in different ways. It can be specific fears, it can be global fears, it can cause depression. People can get very obsessional about their hand washing and their hygiene, and very compulsive to the point where it's interfering with their daily activities and quality of life. Why don't we go to the next slide? These anxieties can rise to the level of specific behavioral health diagnoses. These are the criteria for a specific phobia, which is the topic of this discussion here, which is a marked fear or anxiety about a specific object or situation, which in this case could be the virus itself or gatherings in which a virus could be transmitted. It is a consistent and intense fear, and it leads to a change in behavior. It leads to avoidance. And in this case, if this lasts 6 months or more, then this would qualify as a specific phobia. Since the pandemic began in February or March in the United States, we've reached that 6-month threshold. Why don't we go to the next slide? In the absence of the specific phobia, generalized anxiety is not uncommon. This is also another condition that causes great suffering. Anxiety is a terrible symptom, and it is relentless in generalized anxiety disorder. The person cannot control it. They become morbidly and understandably preoccupied with it, and it begins to affect their physical health because of the interference with sleep. It causes fatigue. Relationships suffer because of the irritability that takes place. And it interferes again with social, occupational, and other areas of functioning. In this case, with a business webinar, the interference in occupational functioning is concerning. Let's go to the next slide. In the Journal of Personality and Individual Differences, which is one of our medical journals, a publication earlier in the fall around an actual scale for looking at specific phobias around coronavirus was published. So let's go to the next slide. These factors involved with coronavirus phobia, COVID phobia, fall into different categories. So on this slide, we illustrate the psychological and the psychosomatic, or the physical, factors that are involved. So you can see psychologically, there's the fear that one would get infected or a family member would get infected. The news around the infection rates and deaths just contributes and grows this anxiety. The uncertainties around having a vaccine, is it safe, can I get it, and so on and so forth. The rapidity of the spread. In terms of psychosomatic factors, people can have physical symptoms, stomach aches, chest pain, tremors, sleep problems. And these can lead to call-outs from work, fears that they have symptoms of the infection itself. Let's go to the next slide. There are also economic and social factors. The economic factors, the fear of having shortages in the markets, the fear of not having employment can be extreme. And then socially, people begin to isolate. They become afraid of other people. They avoid going to the store. They have panic attacks while they're in public places, for example. So there's a lot of what we call morbidity. There's just a lot of burden here with, for some people in particular, with the coronavirus. So let's go to the next slide. So what can you do as business leaders and business owners? I think, first of all, it is very important for your staff to be educated based on the science around coronavirus itself and around how viruses are transmitted in general. If you're not controlling the education, you're at the mercy of where the patients get this information from. Things are all over the map with this on the internet because of the political implications that appear to have been coincident with this. And people may or may not be well educated, but you need to have a well-educated staff. And in addition to that, as I've been saying, wellness suffers. Healthy habits are being neglected during this. So a very visible support and encouragement of wellness and health-related behaviors among your workforce is important. You need to keep an eye on your staff for signs of stress. Actively look for it. We have two ways that staff react to this. One is absenteeism, frequent call-outs. That can be very frustrating because we need the people in the workplace, but that could also be a sign that they just have an excessive fear and that they're overreacting to things. So Don't neglect the people who are calling out frequently. The alternative is presenteeism. They show up to work because they're afraid of losing their job, but they're white-knuckling it, they're avoiding meetings, their productivity is poor, and they're just morbidly preoccupied. When you see that, you should act on it. Have policies to protect your workforce in place. Make them visible. Have adequate PPE available. Let your workforce know these policies are guided by the science and that we're enforcing them for everyone's safety. One thing that's beneficial would be having the workforce available for a Zoom meeting in which people could just talk about the workplace, where they're seeing things working, where they're concerned about things, just to show that leadership is engaged in protecting them. And model these behaviors in the workplace. Wear your mask. If you have a policy for goggles, wear them. Check in with people. Distance yourself from people. Don't have meetings where people are forced to sit elbow to elbow. Move the chairs around and show them that this is a safe workplace. And if you interface with the public, show your workers that you're concerned about them by insisting that your customers in contact with your employees wear masks. That will help greatly in giving them more courage and addressing their anxieties in the workplace.
Well, thanks,
Thank you
Dr.
very much.
Campbell. Thank you. You know, you really give us an awful lot to think about. I think everyone is concerned about not contracting this virus, or if they do, what could happen. And then it seems to escalate for some people into, you know, real anxiety problems and at a bit of an extreme, you know, phobic type of issues that you described. So an awful lot for us to think about. So thank you for that. I'm sure many of you know our special guest today, Maine State Chamber President Dana Connors. He's been leading that organization for more than 2 decades. He's a Presque Isle native who loves his community and his state, and it shows in everything that he does. Dana, thank you for joining us. None of us have ever seen such a universal impact across all of Maine businesses. Tell us about the Me Counting on You campaign and how it can help. Dana?
Thank you very much, Dr. Gilkey. And also picking up on what has just been presented to us, which I totally find very impactful and helpful. I do want to take the occasion to actually thank all of you at Northern Maine Health for giving me this opportunity to be on and share this program that the state chamber, as well as local and regional chambers, have put in place. I will say, as important as I know it to be to help manage this pandemic, it pales in comparison to what all of you are doing on the front line in the medical services. And let me be sure that I shout out a thank you to all of you, and I hope you know how much we appreciate it. Yeah, let's talk about, as I lean into this Me Counting on You, I think it would be beneficial to build to that point by saying, on March the 17th, when we realized that we were as much a part of this challenge as anybody else was, there were a number of things that your local and regional chamber came together on to say, you know, we don't have the experience, we really don't have the knowledge, but we know there's a role. We know that people are at work trying to help with this. How about if we share information? We provide access to resources. We connect you with different people that may have the answers. And so the state chamber with local chambers met twice a week. We went about the task of building that network, providing those resources, information, the connections, and so forth. And then May came along, and up until that point, we were getting more information about things that we can do and things that we must do. And in the context of that, the governor placing public health as a top priority, and we've always commended her for that, because you cannot have a healthy economy, as she says, without healthy people. And we subscribe to that for sure, and commend her for making that a top priority. But at the same time, she recognized that there is along with public health, there's an economic health that goes with this. And that she had released a phased in program over the course of the summer months. And in that in that discussion, it became apparent to us that there were some things that we could do, simple things, yet very meaningful things, like requiring people to wear masks, recognizing that washing your hands thoroughly was important, social distancing had a factor. And with that, the very slide that you see is really the beginning of a public awareness campaign for Maine businesses, helping with Maine recovery, but always keeping public health first and foremost. And the decal that you see, which is primarily the basis for what I'm about to share with you, became kind of our mantra, became our focus. It was about me, this is me, whether me is taken to mean the state of Maine or me as an individual. This is me counting on you. We want people to be safe. We need them to be responsible. We want them to be healthy. But most of all, we need to work together. It simply meant that I have a responsibility to myself, but I also have a responsibility to you. And in the context of that, we believe and we feel that likewise, you have a responsibility to us. Once again, it's simple, it's straightforward, but it's very meaningful. And it recognizes that we can beat this, but we have to work together to do it. And the state of Maine is counting on this. Our public health is important to that, and also the economic survivability. And so what you find is that this became our direction. And we started to create ways to spread the message, to show people that we were counting on them, each other, to address the public health, but also to help with this Maine's economic recovery. And we began with really it was a website on our regular mainechamber.org site. We do have a COVID page that allows for people to see what has been done over the course of time, but we felt it was important to establish an individual website that is mecountingonyou.com that provides people with specific information about a number of things, ranging from what to do, how to do it, what are the resources out there. We did the same because social media is so important these days on hashtag #mecountingonyou to provide that same information. And then we established a PSA, a public service announcement that we carried on television that probably many of you have seen. And if you went to our resource page or went to our website and looked at the resources, you will find our video there. We encourage you to see it if you haven't already, because it does point out in very meaningful ways how we do count on each other and how important it is to work together. But we also found with time, there were other resources that were extremely important that would help spread the message that businesses really liked, because it gave them the opportunity to share the message. And again, the PSA, which is publicized on public television principally, but other means as well as social media, helps to spread the word. But we also had a virtual bumper sticker, which is really something that you could download, you can put on your website, and it takes you directly to our resource page. We have floor stickers that, as it says on your slide, that's 12 inches that I have a couple in my office, several businesses have put it, and it shows once again that this is me counting on you. It's about being safe, responsible, and healthy. And you also can go about co-branding a number of posters that we have created. And if you go to that resource and click on to the poster icon, you will find various samples that will show the decal that we just have seen, but also underneath it will say, wear face covering, so we can get back to our business of serving you. Others might say, we are committed to doing our part so we can serve you, or just simply thank you. All of those are there for you to just simply download, perhaps add your logo, but it gets the message out. And one of the others that we have found to be very serving the purpose that businesses really like a lot is what you're seeing on your screen right now. And those are really, thank you. I mean, those are the opportunities that we can present, or a business can present to their customers, be it a retail, be it a restaurant, perhaps it's a hotel or a other hospitality type of service that simply says, thank you for being sensitive. Thank you for working with us to keep people healthy. And it helps open our economy safely again. I'll end with this point. All of that information, as important as it has been, as much as our effort has been steadfast and helpful, both in terms of working with our chambers, but also getting the message to business as well as customers, that need is perhaps as strong today, if not stronger, because we're finding that, as Suzanne has pointed out, we're going into the holiday season, the cold winter months. There is a tremendous anxiety around, and the governor has been very clear with us, with me personally, but also in the media, that she wants to keep public health front and center, but there's also appreciation and recognition that the economy in these months are very important and that she's looking for our help. So this is me counting on you is extremely important. It helps both in the public health, but it also helps immeasurably when it comes to that balance of keeping our economy strong and viable as well. So the last page says it all. It's an opportunity for us to thank all who have taken part in this. We ask you and urge you to continue, and it does take all of us working together to keep people healthy and our economy safely open. And you can get more information by going to our website, or certainly letting Jen Weber, jweber@mainchamber.org, email to her anything that you have on your mind concerning this or any ways you'd like to help. So I thank you for the opportunity, and I sincerely thank you for your service. It's been a pleasure to be with you. I am so impressed by not only what you do every day, but for the program that I have just been witness to, and I know that follows me. Thank you.
Well, thanks, Dana. We really appreciate all the resources being shared with our participants today. Today, I'd also like to welcome Dr. John Armstrong. Thank you for joining us today to give an update on the dynamic world of COVID-19. What's the latest, John?
All right, thank you, Dr. Gilkey, and good morning, everyone. I am at work, so I will be keeping my mask on for this presentation. Well, it feels like March again, and not just the weather. With all of the fear and uncertainty, the rapid pace and seemingly daily changes to the science, the medicine, and the policy decisions. With a little bit of luck, the updates I'm about to give will still be current by the end of this meeting, but I can't promise anything. Joking aside, the surge that we have been fearing and preparing for since the news of this virus first emerged is here in Maine and nationwide. From the first case in Maine in early March up until the last week of October, the state of Maine averaged roughly 20 to 30 cases per day. Over the past 3 weeks, we have seen average daily case counts jumped to nearly 200. Statewide, we have 85 individuals hospitalized, whereas a month ago there were only 7. Currently, Eastern Maine Medical Center has 16 inpatients with COVID-19, which is a new high for that facility. While much attention has been paid in the news media to some prominent outbreaks around the state linked to churches and nursing homes and correctional facilities, there is moderate to high community spread in all 16 Maine counties. The rise in cases is driven not by the outbreaks, but largely by community spread and small gatherings. In fact, a recent study published in Nature using mobile phone data characterized restaurants, bars, and gyms as the public places at highest risk of spread, though still secondary to household gatherings. Because of this, diligence with basic precautionary measures such as physical distancing, face coverings, and hand washing is paramount to all of our safety. And while you're likely all aware of this, to reemphasize, about 2 weeks ago, Governor Mills issued an executive order in response to the rising case counts. As a part of this, owners and operators of all indoor public settings in Maine must now provide plainly visible signs notifying entrants of the requirement to wear cloth face coverings, and you may legally deny service or entry for individuals who refuse to comply with those recommendations. Regarding the upcoming cold and flu season, as of this past Tuesday, the Maine CDC has only reported 11 positive influenza cases this season. and the national CDC has reported 0 cases of respiratory syncytial virus, or RSV, which is a severe respiratory illness which can affect young children, typically babies to toddlers. So 0 cases of RSV so far. This is roughly consistent with the usual yearly trends in Maine for mid-November. Rhinovirus, the virus responsible for the common cold, has been increasing statewide. Influenza data reported to the World Health Organization from Australia, Chile, and South Africa showed very low activity in June and August of this year, which are the months that constitute the typical Southern Hemisphere influenza season. And regionally, in March of this year, we saw local influenza and RSV cases at or near usual seasonal highs plummet to almost 0 with the widespread implementation of basic precautions against COVID-19 at that time. It's worth noting here that there is substantial herd immunity against both RSV and influenza in the community, and we have the added protection of a flu vaccine. Anecdotally, in my own clinical practice, I have seen a large increase in interest in the flu vaccine, even in patients who have refused it from me previous years. On the topic of vaccines, as you've probably heard, last week Pfizer issued a press release indicating that their vaccine appears to be about 90% effective in preventing symptomatic illness, and on Monday, Moderna Pharmaceuticals announced that their vaccine is about 95% effective in preventing infection. Yesterday, Pfizer released another update, now reporting also 95% efficacy. Both trials have included individuals of diverse racial and ethnic backgrounds, as well as the elderly and those with chronic medical conditions. Both are a 2-dose series, about 3 to 4 weeks apart, and neither vaccine seems to have significant side effects. Trials in children are ongoing. Pfizer does intend to apply for emergency use authorization with the FDA within the coming days, and Moderna within the coming weeks. It's important to note that the vaccine approval process requires independent scientific review of the safety and efficacy by experts at the FDA, as well as a risk-benefit analysis by the CDC's Advisory Committee on Immunization Practices prior to emergency use authorization being granted in the beginning of distribution. The state of Maine does have a mass vaccination plan and will be ready to distribute upon authorization of 1 or more vaccines. For those who are interested, Dr. Shaw did explain this in great detail in his 11/17 update, which is available on the Maine Public YouTube channel. In short, Maine intends to start the vaccination process with healthcare workers and other first responders. Sputnik from Russia and Oxford from the UK have both also reported phase 3 trials of vaccines with 90 to 99% efficacy within the last week alone. And there's nearly a half dozen other companies with vaccines in phase 3, I should say, or final stage trials in the United States, with results expected by the year's end. So lots of exciting things coming. There has been concern about duration of immunity and the possibility of reinfection. Encouraging data, though yet to undergo peer review, was recently released by an immunology group out of La Jolla suggesting long-lasting immunity, though significant uncertainty exists in the scientific literature. I should emphasize that reinfections are exceedingly rare and with only a handful confirmed among the millions of individuals worldwide who have been infected with COVID-19. Next slide, please. Okay, an update on testing. So Northern Light is now performing COVID-19 testing on all inpatients, regardless of symptoms, at all facilities, all inpatient facilities statewide. All symptomatic patients, those tiers 1, 2, and 3, will be tested for all 3 COVID, flu, and respiratory syncytial virus, or RSV. The state of Maine is reallocating the analyzers we currently use for our rapid COVID-19 testing, and as a consequence, we are moving to a new test that can rapidly detect COVID-19 and influenza simultaneously. This rapid test will be used to test symptomatic patients in emergency and direct admission settings and for asymptomatic laboring women. On a related note, the Mills administration also recently announced it will distribute 400,000 rapid antigen tests for symptomatic people, including 300,000 provided up to 65 Walgreens locations. From Kittery to Madawaska, testing is now available to people who have symptoms of COVID-19 at no charge as a drive-through service at 10 Walgreens locations, with more than 60 additional locations scheduled to be available by the middle of next week. The remaining 100,000 tests will be prioritized for Maine people who are symptomatic or are at elevated risk of exposure and illness from COVID-19, such as critical infrastructure staff. Demand for testing has increased dramatically with the end of the school semester and with the upcoming holidays. Maine does remain number 1 or 2 nationally for testing availability per population. Part of the uncertainty around testing currently arises from the multiple parallel organizations providing the tests. The main CDC aims for and is achieving a 24 to 48-hour turnaround. And anecdotally, from my own patient's experience, I can say that the Eastern Maine system has a roughly 48-hour turnaround, at least in the Bangor area. To reiterate, when considering one's need for testing, the CDC also recently changed their recommendations on what constitutes a close contact. This is now defined as someone who was within 6 feet of an infected person for a cumulative time total of 15 minutes over a 24-hour period, starting from 2 days before the infected contact, or before the contact with the infected individual, and continuing until the test collection. Risk of contracting infection increases with duration of contact, symptoms, and potential to generate aerosolized droplets and environmental factors such as ventilation. Next slide, please. All right, so Suzanne has done an excellent job covering Thanksgiving, so I won't belabor her points. I do have a few other comments. As I mentioned earlier, the steep spike in cases that we are seeing is driven by small gatherings. In Canada, where they celebrate Thanksgiving in October, we have a ready-made crystal ball for what a risk this holiday poses for us here in the US. And in fact, that country, in which community spread is much, much lower than it is here in the United States, they did in fact see a large spike in cases in the 2 weeks following their Thanksgiving, and that was attributed to these small family gatherings. I have personally started asking all of my patients at their clinic visits about their Thanksgiving plans and counseling them on safety. In general, the safest option is to celebrate with your immediate household only, and any sort of gathering, even with the best, strictest precautions, should be considered significantly higher risk. For those who are interested, finally, the New York Times recently ran some articles detailing how to scale down some of the most common Thanksgiving dishes to household proportions so that you're not still all eating Thanksgiving turkey at Easter. In conclusion, there's a lot of information out there, and if I could offer one takeaway from today, it would be this. The outlook right now is grim, and there is reason to believe that conditions will get worse before a vaccine is available. We do know that spread is driven by small gatherings and community contacts. We also know that our mitigation strategies are effective, but if and only if people are consistent in following them. It is the responsibility of each of us to protect ourselves, our families, coworkers, our employees, and our customers, patients, and community. So please, wear a mask, physical distance, limit indoor gatherings and contacts by necessity only, and encourage others to do the same. Have a safe and happy Thanksgiving. Thank you.
Thanks, Dr. Armstrong. I'd like to make a couple of points here. First off, you see that I'm also at work at Northern Light Health, different area than what Dr. Armstrong is. And our policy requires when people will be coming in and out of your space to have a mask on, hence Dr. Armstrong has one on. I'm in actually a closed room that's just my office. Every time I step out beyond that door, I need to have a mask on and do so. So just so that you understand, there's not inconsistency at what you're looking at Northern Light Health.
This is a shared room, yes.
Yeah, exactly. So I'd also like to reinforce the idea that Dr. Armstrong just shared with us. If you think back to how we all felt in mid-March, April, and May, and how dangerous this unknown coronavirus seemed to us, I would point out that thanks to community transmission and the increasing positivity rate you've learned about from us, as well as the increased prevalence in all counties in our state, today is actually more dangerous in terms of contracting the coronavirus than it was even in May. So I think when you think about these different decisions that's upon us for the holidays, take that into serious consideration. So now let's focus on your questions. I will group similar questions together so we can address as many questions as possible. And I see in our chat room that Andy has done a nice job in pointing the direction to where you can get all of the presentation material. And in fact, you can get the presentation materials and all the resources that we've provided since day one of this series on that same site that Andy draws your attention to. So now the first question is for Dana. With the virus spreading in Maine so significantly, what are you hearing from your members?
Well, I would say that both your point as well as Dr. Armstrong's message clearly is not in the back of the minds of business people, it's front and center, because there is definitely a concern. There's no less a commitment to do what's right, to be sure that our campaign and all the things that you've talked about is an important part of their day-to-day mission. But because of the rise in numbers, because of the season we're in, keeping public health front and foremost, but at the same time, making sure that we find those ways that we can work with the economy so that it suffers to a minimum, not a maximum. I think that, you know, there is fear, there is anxiety, because we do know that it's gotten bad and predictably will be worse. And what can we do? I, in every occasion, remind them that people are hard at work to try to contain and to work this. There will be some things that will come forward in policy that will make it more difficult, but our governor very clearly has been very sensitive to balancing the two, and certainly not sacrificing public health, but recognizing the value of the economy. And the "this and me counting on you" really resonates its importance today, probably as well as, if not better than, anything we've seen in the past. It is vital that we recognize and value that.
Yeah, that's great information there. You know, I think clinically, needless to say, and it was just about 4 to 6 weeks ago, our hospitalizations in Maine for coronavirus numbered at 8. And now we're seeing numbers across our state in the 60s, and unfortunately, you know, too many are in the ICU on ventilators as well. You know, luckily we have the capabilities and the care across our health systems in Maine, but it is escalating, and it is very serious. And you know, I don't like to grab onto the cliches. We're all in this together, but I think the resources that we're providing here and the resources through our chamber are going to be critical for people to tap into and to rethink. Some of the experience we had over the summer where it seemed like it was a lesser problem, we need to rethink it and get back into it, roll up our sleeves and really attack the problem. The next question, actually 2 questions, are for Suzanne. The first one is, coronavirus is really taking hold in Maine, as we've been discussing, both through community and household transmission. You know, it's gone beyond these outbreaks that we were talking about over the summer, where it almost seemed isolated to these pockets. Now it's really within the communities, it's within the households. We're hearing the stories. So is now the time to plan for next year and just stay home this year?
Frankly, yes. I think right now is the time that we really should be hunkering down, staying within our own social bubbles as much as possible. You know, you might, if you're optimistic, you know, think about, you know, a Christmas in July or a mid to late summer type of party. But for the winter holidays right now, as much as you can avoid it, it really does make sense.
Yeah, I think that's an important one. You know, tying into that, a question just came into our chat room. I am worried about opening my small home-based lodging business safely. Any suggestions? Suzanne, you seem to be positioned to respond to that.
Yeah, I mean, it certainly can be done, but it can be a little bit tricky. As much as possible, if you have a lodging business, if you can distance when those visitors are coming in, maybe leave a key, do some type of remote check-in, so that way they're not interacting with you, you know, person to person. So You might have them do the registration online, and then when they arrive, there's a basket with the key to where their room is. I would also make sure that you have rules that are really available to them, letting them know kind of what the times are to walk in and out of particular, portions of your, if this is, within your home, what parts of your home are off limits, and the common areas, what are the times that they can utilize those up front.
Mm. Just about an hour and a half ago, I was speaking to the Northern Light Beacon Health leadership team. And, of course, part of our discussion goes around coronavirus as well. And I was sharing with them that, in the first 8-9 months of this, no end seemed to be in sight. There was sort of like the hopefulness about a vaccine, but no end in sight. And we were talking about maybe a second surge, and now we're in the point where we're either like defining like the first surge continues going and is getting bigger, or it is a second surge or a third surge. That's all pretty immaterial. I mean, it really is increasing. There's no question about it and how we define it. But the good thing is, we do have the vaccine right on the cusp here. And if you think fast forward to June, life will be, in a positive way, better. It may not be over, but it will be better. And so we need to make our decisions now, not as if it's no end in sight, but in fact, there is an end in sight. So I hope that's helpful for everybody in terms of making their decisions. Dr. Armstrong, I'm going to give you this question from our audience. What if someone refuses to wear a mask, stating it is due to religious reasons? And I don't recall seeing any list anywhere about religious reasons for that. Maybe you have, though.
I have not. I have not encountered that particularly, or that particular instance in my practice. What I do see a lot of is people wear a mask into the building, they get put in the exam room, and they take the mask off, or they are wearing it down below the nose, or they take it off to talk for some reason, putting it below the chin. If they take it down to take a drink of water and don't put it back on again, forget about it. So a lot of what I do is encourage people and educate them on, the importance and proper mask wearing technique. I have on a number of occasions been asked to provide documentation of a medical reason for which individuals cannot wear a mask. This is something that gets touted about a lot. It is actually probably not as common as it has been made out to be in the public sphere. The overwhelming majority of people, even with severe or chronic respiratory illnesses, can wear masks safely without impacting their health in any way. Mm-hmm. And the safest thing for even people with severe, respiratory disease is not to worry about the mask, but rather, wearing the mask as part of protecting themselves from contracting COVID from somebody else. Mm-hmm. And I would also make the argument in this particular instance that this isn't really a question of freedom. It's really more of a question of doing what you can to protect yourself, but also your responsibility to protecting those in your family or community who may be much more vulnerable than you are. So if you're, if looking at it from a religious standpoint as a perspective to protecting the vulnerable by taking action yourself, I think that would be my approach to that particular question.
Great. Well, thank you, Dr. Armstrong. I really think it is important to follow these relatively simple guidelines, and there is some sacrifice of personal freedom at the point where we're really trying to manage populations of people in a public health sense. I will check in real quick with Suzanne. Is there anything you're aware of in terms of religious reasons for not wearing a mask?
In terms of mask wearing, there really isn't anything that I have been able to find out uniformly that mm-hmm. I have not heard of any particular one religion that would shun mask wearing. I think it's, more individual pockets.
And then could you quickly point out what the Northern Light Health policy is relative to masks going into the hospitals?
Yeah, absolutely. And this is a change that we've had very recently. We've required throughout the pandemic that everybody has a face covering on. Because of our vulnerable population, we're now asking all patients, visitors, vendors that come into our facility, not only to have a face covering on, but we're going to provide that face covering. So everybody will be wearing a medical grade mask. This is different than what you would see in the community, and that's simply because we have the vulnerable patients that we're caring for. So we're really trying to protect our patient population.
And then we stop people at the front door who refuse to wear it, isn't that correct?
Absolutely.
Okay, so hopefully for our business owners, that gives you a sense of how we're handling it. Dr. Campbell, I have a question here for you. As a business owner, if I see some of the symptoms you described in an employee, what should I do and not do?
Well, let's start with what you should not do, which is ignore it. What you should do is reach out to that employee and have a private conversation with them, masked, distanced, or through email if you want to keep it that way, and just openly say what you've noticed. I've noticed that you look preoccupied, your work output's falling, and I just want to check in with you. There's a lot going on in the world and the country right now. How are you doing with all of this? I'll give you an example. A colleague reached out to me and said that she was really struggling with her role, with having to work with a couple of direct reports. Standard stuff, not something I would expect her to have a problem with. And I said, so how are you doing? This is normally something that you're handling well. And she opened up to me about, how the whole pandemic was really, she was struggling with it. It wasn't a specific case of COVID phobia, but you'll never find out until you speak with them. And then you can brainstorm about, how to help them with that.
So really embracing the issue instead of avoiding it is really the take-home message, it sounds.
Yes, connecting.
Connecting, great word. Well, once again, I find myself having another hour's worth of questions for our panel of experts here and running out of time. So we've included some additional resources for you at the end of the slides today, and I think you could see them up here now. Thank you all for joining us. I hope this hour has been a help to support you, your employees, and our communities to safely stay open. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. And quite honestly, we debrief and actually take that information and craft the future conferences off of it. So please do that. Our next session will be on December 3rd and will focus on wellness in the workplace. The topics include worksite wellness, virtual wellness, feeding the body and soul, and the latest on COVID-19. As you can see, that's a very dynamic, changing collection of information. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a safe Thanksgiving.